One of the expensive aspects of the healthcare is testing, and this is a judgment call. I mean, you could always get one more test. Tests are very expensive. So do you think having this open communication would lead to more realistic results as far as, well, how much testing should you give to a person? Does it only depend on how good his insurance is? Or should there be some kind of standard, like, I mean, we're not all going to live forever, no matter what you do. You know, it's going to end one way or another. So should we be making desperate attempts to give every test possible, providing somebody is going to pay for it?
There are only two certainties in life, no matter what kind of insurance coverage you have. And one is that you're born, congratulations, happy birthday. And the other is you're going to march along life and at some point you're going to die. I'm sorry. And in between is where we have so much opportunity to optimize not just the care that we're talking about that's highly episodic when something goes wrong, but the life decisions that we make over time. And I think right now tests are snapshots. They're like fossils. They're one glimpse into something that happened to us and we're looking at the body's results. When we can put into context the decisions that a person is making over time and then add the additional information granted by these tests, I think we'll test less, we'll use the patient's information more, and we'll save not only that person and their doctor time and insurance coverage money, but also the system as a whole. Because health is individual before it's exponential. We have to improve the personal standard of care and the personal standard of living before we improve a population or community's use. So if what we want to do is reduce tests over time because they cost a lot of money for the system, we have to reduce the individual's use of testing. And I don't think we'll be able to do that until we have more information about how people make decisions.
Do you think that social networking tools also help a lot with medical research because doctors can share their results much quicker? Right now, if you develop a new drug, it takes years to go through all the approvals, and there are a lot of restrictions because society has become very risk averse.
Right.
We don't want anyone to take any risks, and that's expensive, avoiding all risk.
Yeah. So there are. So I don't know actually if your networks actually do kind of patient research or aggregated research, but there are 23andMe is a company that's doing aggregated patient research. Patients Like Me is doing aggregated patient research. It gets a little more complicated when you talk about doing drug clinical trials with those kind of ad hoc research groups. So far, the FDA hasn't figured out how to take advantage of that. But the traditional system, what we know is that the traditional system that we have for doing research is slow and laborious, and it doesn't have to be.
And inefficient, and too expensive. And what we have, if we look at people as an asset, and the data that they're already sharing on social networks, there is a huge body of data out there that can be used for more efficient research about how to improve our health. We're not tapping into it except in very limited exploratory ways currently. So there's a lot of promise for communities like Cure Together.
Yeah, and this is the way data is reshaping all sorts of industries, right? So this is the way data is reshaping everything from manufacturing to retailing. Yeah. Data is correlations are emerging out of the data rather than the data being gathered to try to get at various hypotheses. Yeah. And that's what we have the opportunity to do with healthcare now.
I would think that you could also detect patterns of disease much more easily.
That's exactly it.
If there's a cluster or high incidence of a certain ailment in a certain location, it would be easier to spot that, and then you could figure out what the cause of that was.
Absolutely. Yep. Pattern recognition over time. And if my Netflix account can tell me that I like romantic comedies with strong female leads, why can't my hospital information, you do too, Tom. Why can't my hospital information tell my doctor that over time I don't like to take prescription medications, that I would rather use alternative methods of treatment, and they should talk to me about those options first? It's just ridiculous. We have the technology. We just need to change the culture.
Well, it sounds like the internet is a boon to almost any kind of human activity. It makes information so much easier to get to. It really makes possible all kinds of things that you just couldn't do before.
It's just another channel for content and community.
Okay. Absolutely. There's lots more I could ask you, but I've just got the signal that we're almost out of time. So we are going to have to wrap the show. I'd like to thank my two guests, Jennifer McCabe and Thomas Goetz. Thank both of you for being here. It was a pleasure having you.
Thank you, Marty.
I'm Marty Wasserman. Thank you for watching. Be sure to tune in again next time. Also, please visit our website at www.futuretalk.net. See you again next time.